So we are here in my office with my lovely assistant Liz and my equally lovely patient who needs to have her upper left wisdom tooth removed. It's not a difficult tooth, I believe, and she has wonderful freezing, which we've already done. And now we're just going to get started, and I'm going to begin by loosening the tooth with this periotome, and then from there we're going to use an elevator and a forceps to remove your tooth. Okay? Feeling good and numb?
Yep.
Nice. Okay. So Liz is going to have her suction in. You can see that we're being as ergonomic as possible. I'm sitting here on my saddle chair. My back is straight. I'm using my quads, and I have a pair of loops that have been set to give me a nice angle of declension so that I don't have to lean in an awkward fashion. I can just use these loops and be quite ergonomic. And Liz is I think pretty reasonably ergonomic. Okay, yeah, we're just going to start by working around the tooth, and we're just loosening everything around the side. I'm loosening the arm. Just a little pressure up, really loose, and we're just going to force on the tooth, and now we're going to just rock and roll. Okay, so I think we got, okay, so some of the crown mainly, and one of the buccal roots came out, and the palatal root is still there. Okay, so I better get the elevator back from you again. Can you see now how everything has changed? I'm now hunched over. My spine is in a C-shaped position. My right arm is here. I've internally rotated this shoulder in a big way, and I could be here quite a while I'm trying to find this. And can you suction? I can't see. No more over there. No more over there, please. Can you? And now she's struggling, and she's hunched over. And thank you. Who knows how long this is going to go on for? Until we finally loosen that root. Hunched over this patient, trying to get this upper left wisdom tooth out. And so I quickly went from this position, where I was quite ergonomic, my back was straight, shoulders back, trying to work like this. But the reality is that we very, very often, on a regular basis, devolve to a position where we're like this. We're hunched over, we're holding a static position, shoulder internally rotated, far too long. What if I was a dental hygienist? What if this was a cleaning instrument? And you're just in here for a cleaning. Okay. I'm very nice and ergonomic, and I'm cleaning the tartar off your teeth, and I'm cleaning the tartar here. And then I find, again on an upper second molar, that there's a real heavy tartar deposit on the distal of this tooth. And I've tried using the ultrasonic scaler, and I got to use a root planer, and now I'm here. Not a lot different. Maybe not quite as drastic, but now, and I'm really using that curette to try to clean that tooth. And I'm hunched over. I've lost this, and I'm here. The point of all this is that we strive to be ergonomically correct every day in our dental offices, and then reality creeps in. And no matter what we're doing and how good we are, we're going to end up in long-held static postures that involve internally rotated shoulders, no longer straight backs, but C-shaped spines bent over. And for the poor hygienist, assistant, if you could pick up that suction again, and maybe your water syringe. And what if we were just doing restorative dentistry? Now, I'm working here a long time. She's going to be like this, helping me, keeping things clear, blowing air for me, bent over, shoulders in, way too long. And in my view, this is at the heart of what goes wrong and why dentists and assistants and hygienists end up with so much trouble here, here, here in the carpal tendons, in the back, and if you're in this profession for years, it takes its toll. So what goes on here on a daily basis is the reason behind we need the Therapeutics series that is also shown on this website. And I guess the other thing that I think bears mentioning here is that as well as all of this stuff that happens here with our internally rotated shoulders and long held static postures, what happens when we walk out the door? We get into our car, we have our foot on the accelerator in that long held posture, just like my foot's on this rheostat in that long held posture, pretty similar. My hands are on a steering wheel, my shoulders are internally rotated, and I'm like that all the way home, just like I was in the office. Then I get home, and there's something interesting on the computer that I want to look at. So I flip open my laptop, and where do my hands go? They go here like this. Once again, internally rotated shoulders. Then I start to cook some dinner, and someone calls me on my cell phone. So I pick up my cell phone, and I'm like this. What again? Internally rotated shoulders, C-shaped cervical part of the spine as I'm looking at it. Basically an entire day of unhealthy static postures that involve flexion of the spine without extension of the spine. Internally rotated shoulders instead of posteriorly rotated shoulders. And that's why when you look at the Therapeutics series that we filmed today, along with using balls for pressure points, etc., etc., most of what we're doing involves the body in a gentle back bend. Just think about that in your daily practice and think about what's going on and what you can do to find remedies. And as I've repeated before, these problems develop over a very long period of time, not even just weeks and months, but years. So if you try using my therapeutic series or any therapeutic series that is similar to what I've shown you, please don't expect instant results. It's not going to take as long to undo the problems as it took to create them, but it's not going to happen in days. It may not happen in weeks. It may take you months before you start to realize, hey, things are getting better. But don't give up, because things can get better.